And there's 4 different committees right now. And we don't even know what the final bill's like. So when they do get it, it's got to be given out to the people. And I think the press has to do a better job teaching the American public what's in each part of the bill. I think that's a real challenge for the media.
Doctor, I'm gonna lay this on the line. I'm gonna say that I'm gonna hopefully rely on you and that you'll report back to us as this develops so we can talk about it more in depth and get the listeners the facts and we can instruct them what to do. Hey, JD, thank you very much for the call.
Yeah, thank you.
All right, Farrell has I also take questions through email, Blaine at WFMD.com. Farrell emailed me and said, will places like Mission of Mercy be even more needed should this government health insurance plan go through?
Absolutely. The Mission of Mercy, basically, it helps people who don't have insurance, and they do an incredible job helping people who are immigrants to this country. Now, here's an interesting fact for you, since you emailed me. The state of Massachusetts had the first bill passed in the United States to give mandatory insurance to all citizens of Massachusetts. Guess what happened last Friday, Blaine? You won't believe it.
What?
They went bankrupt. So they took all the insurance away from all the legal immigrants. How do you like that? The legal immigrants in Massachusetts had their health care ripped away from them because they couldn't pay for it. Because they thought, guess what? It's budget neutral. Wrong. They didn't have the money, so who did they take it away from? From the poor immigrants. So now these people are back on the street. And how does that feel when you had insurance? Now, Monday, you don't have it again because they didn't do the math. And that's where people like you are clever saying, where's this $1.7 trillion going? How are we going to pay for it? Didn't we just borrow $1.5 trillion for the TART and General Motors? Yeah.
And the Chinese are telling us to slow down on our spending.
Yep.
Let's go to Bob. Bob, welcome to the program. You have a question for Dr. Vitarello?
Yeah, Blaine, I'd like to say that I was a patient of Dr. Vitarello a few years ago, and he's a wonderful person. And I think that, you've got a lot of pull. I think you ought to call Roscoe Bartlett and have Roscoe Bartlett take him down to the Congress and have him express his views to the Congress.
Well, actually, I have to say this much. Yes, I do have a lot of pull, but Dr. Vitarello has a lot of pull, and he's been in contact with Congressman Bartlett's office and Chief of Staff with Bud Otis.
All right, I talked to Bud today, by the way, and I'm actually Bartlett's medical advisor. I can tell you this about Congressman Bartlett.
Now, I want to make one thing clear. I did not know that. I asked Dr. Vitarello because I know he's very, very well versed on the subject. When I was actually in Vegas, I called his office. He was on vacation, and we corresponded. But I wanted, there's a lot of things being talked about healthcare. So I thought, I want to get somebody that understands what's going on, understand the facts, that can talk intelligently. A lot of times I rant and rave. That's why I wanted to have Dr. Vitarello here today, and I appreciate him very much for coming on. But, Bob, he's in communication with Congressman Bartlett's office constantly.
And can I tell you something? Congressman Bartlett is a friend of patients, and he's a friend of medicine. And he's against the public option. I talked to Bud Otis today, and they're definitely against the public option. Now, we're hoping that the Republicans are going to vote in bloc against the public option, and they're going to work with the Blue Dog Democrats here to stop this madness. Because there is a good option there that we can use, and I'll explain that in the latter part of the program here. But the most important thing is it's all about the patients. Forget about my pocketbook. Forget about the drug companies. Forget about Obama and his agenda. Whatever party you belong to. It's all about patient care. And if we start cutting back medical services, especially to the elderly, over the age of 64, hello, I'm 57, that's horrendous. We should not take care away from people when they need it most in their life. You don't need health care usually in your 20s, unless you have certain catastrophic illnesses like cancer, etc. The majority of health care is delivered in our age group and in Medicare. So therefore, if it's not broken in the sense of providing great care, don't fix that. Fix the other problems, lower cost, lower tort, these unnecessary frivolous lawsuits, make the drugs cheaper, and educate the patients better for preventive medicine. And that's what we need to focus. So call these guys up and raise your voice a little bit. It says, stop it. Do not socialize medicine in our country. Basically it's a philosophy. Either if you're a socialist, you love this program, but this is not a socialist country. I don't think the lawyers are socialized, are they, Blaine? I don't think so. There you go.
Hey, let's take a quick break. Bob, I want to thank you for your call. And
Wayne, thank you.
Thank you, Bob.
My partner, Jerry Wood, was also a patient of Dr. Vitarello and Dr. Barakat, and actually says point blank, you all saved his life.
Thank you.
And I want to tell you these phone numbers again. U.S. Senator Ben Cardin, 202-224-3753. U.S. Senator, that was actually U.S. Senator Barbara Mikulski's number. U.S. Senator Ben Cardin's number is 202-224-4524. Max Bacchus, 202-224-2651. And Senator Charles Grassley, 202-224-3744. If you need me to get you a phone number, email me at blaine@wfmd.com, and I'll get it to you. As Dr. Vitarello said, we have to make our voices heard. It's imperative that we do so, that you take time out of your day and make a simple phone call. Let's go to the Baron. Baron, welcome to the program.
Hey, Blaine, how you doing?
Good.
Is the doctor still with you?
He's
I'm
going to be
still
here
here,
till
sir.
5 o'clock.
I have a question for you, Doc, since you kind of are a little familiar with what they're trying to do. What's going to be the effect of the on this military medicine?
On what medicine?
Military health care?
Military health care?
Did you say military health care?
Yeah, military health care.
Okay,
yeah,
How is
yeah.
the Obama plan going to affect military health care?
Yeah, this military health care is through the Department of Defense. Now, this is that's a great question, by the way. The Department of Defense, what it does is it has a different medical system than the typical civilian population. What they exceed in, obviously, is in trauma, obviously, in wartime. And what they do is they have great facilities there, and that's not going to be changed whatsoever, especially when we're fighting two wars. And the other part is they have the military hospitals in the United States that take care of the soldiers when they come back. Now, what they've done is basically they started cutting back on services like pediatrics, psychiatry, cardiology, because most of these young men and women don't have heart attacks in the age of 20 and 30. So they're putting all their emphasis on trauma, rehabilitation, to get these guys back on their feet and to a normalized lifestyle. And so military medicine will stay the same. Now, what happens is they outsource their cardiology, and I do that for Fort Detrick, for instance. I see all the guys that come out of Fort Detrick that need cardiac care, and they help us pretty much get their patients back on their feet. And they have a rule: if you're more than 50 miles away from a major military base, then you can get private medicine. So they can see us, and then we send them down to Walter Reed if they need it. Now, the second part of the question is the Veterans Administration Hospital. The VA hospital has its benefits and it has its negative points. I worked at the VA hospital for 6 years. It's good for giving generic drugs and having these people go to the clinics to get their drugs. That helps a lot. But when veterans from previous wars go to the VA hospital and they have heart failure, stroke, heart attack, gallbladder surgeries, those procedures and services are rendered in civilian hospitals, and that spares the VA hospital from these higher costs. So the VA has the benefit of the civilian world, and so does the military system. So the military guys will continue to have great benefits. They will continue to be covered by the DOD. It's the civilian products that will be hit the hardest.
What's that, Baron?
How about the TRICARE with the family?
This is easy. TRICARE is real. You hit a home run on this one. For instance, TRICARE is done through the Johns Hopkins Hospital.
What is TRICARE?
TRICARE is a policy that they give to people if you served in the military, and that's delivered as a healthcare product, like Blue Cross Blue Shield.
Okay.
Now, Hopkins is the...
So you think they'll keep TRICARE around?
Absolutely. They're going to keep the contract with TRICARE. And in fact, absolutely. In fact, my group, Cardiovascular Specialist Frederick, we have the Hopkins staff in our office now. So we have a hybrid practice with Hopkins in ourselves. So we do all the TRICARE. So TRICARE will continue to be in place. You'll continue to have the great services of the Johns Hopkins Hospital unless, here's the unless. What they're going to do basically is they can take you out of the TRICARE if they want to, and you got it in the Obama, and put you in the public option plan. And guess what happens? You then lose your affiliation with Hopkins, because Hopkins might not participate in the public health plan. And the public health plan, guess what? Guess who will be making your medical decisions for you for your hip surgery? The government. Now, do you want a bureaucrat telling you, sir, if you need a hip replacement?
Well, that already happens, but it happens in a different system.
And it's not the right way to do it, sir.
Right.
And I work for the VA hospital, and I'll tell you right now, they've done a lot of things wrong to the vets. That's why they come to private hospitals.
All right. Hey, Baron, thanks for the call.
Thank you, Baron.
You know what it sounds like to me, though, don't you? Sounds like somebody's going to get a screwing if this gets adopted. And you better get informed. You better pick up the phone, and you better make your voices heard. Talk with Dr. Vitarello, the chief cardiologist of Frederick Memorial Hospital. You need to take a quick break. Phone lines, one line open, 301-694-WFMD. I want to thank the Frederick Air Bryant